So urinalysis is a very simple test. It is a preliminary test performed to check the composition of urine, and some of them indicate pathologies. Any change in pH can be caused, for example, either due to presence of bacteria in the urine, or due to metabolic syndrome, or if you drink too much orange juice, it can still affect the pH, right? So urinalysis is a very simple, straightforward test, and if there's any abnormality seen in the urine, they perform further biochemical tests or further radiological tests to check for any pathological condition. Normally, we excrete about 1 to 1.8 liters of urine in a 24-hour period, and the test can be performed by using dipsticks. So these, let me look for the pointer. So these sticks that you see over here, these are called dipsticks, and the dipsticks basically have different regions with different chemical that react with different things in the urine. And every company has its own color code, but you can compare these color codes in here. So this column shows negative reaction, and any other change can be noticed by the intensity of the color on the dipstick by comparing it to the color chart on the bottle that you see over here. So this bottle is actually available over the counter in Walgreens or CVS, so they're very easily available. So the professional kits are slightly different if you're testing for things like ketone. Now, urine is normally yellow or amber color due to a pigment known as urochrome. Urochrome is a metabolic product of hemoglobin breakdown. When a person has a red or red-brown color, that's abnormal, but it could be present either due to food color, or eating beetroot, or a particular drug. Sometimes the presence of hemoglobin and myoglobin indicate a serious condition, right? So if a sample contains too many red blood cells, it will be cloudy as well as red. But if a sample contains some little amount of blood cells which have not hemolyzed, you will probably see it more clear than cloudy. Now, the intensity of the color generally indicates the concentration of the urine. And if you have a really pale urine, it means it is really dilute. Now, colorless urine can also be caused by long-term kidney diseases and uncontrolled diabetes when a person is excessively thirsty and drinks a lot of water, right? Deep urine indicates, well, all these three that you see over here are really abnormal. This is hematuria, meaning the presence of blood in the urine. This is hemoglobinuria or myoglobinuria, meaning the presence of hemoglobin or myoglobin in the urine. And pyuria indicates the presence of pus in the urine. Now, if it's concentrated and really dark but clear, it may indicate really low fluid intake or dehydration. Sometimes supplements of vitamin B can also turn the urine really bright yellow in color. Now, if you perform macroscopic observations of the urine, you can also look at turbidity, meaning how clear or how hazy the urine is. The presence of any turbidity is basically cloudiness. So this is clear, this is slightly hazy, this is really cloudy. Now that's bad, really bad. Now the presence of bacteria can make urine cloudy. The presence of blood can make urine cloudy. But presence of sperm or certain crystals that show up that we'll talk about may also make the urine cloudy. Those crystals are called casts, and the presence of casts sometimes determine the different types of kidney diseases. So the presence of casts, CAST, if you've watched the video lecture, you know what casts are. And casts indicate upper urinary tract infection rather than lower urinary tract diseases. Now, the turbidity, the most common cause of turbidity in the urine is urinary tract infection. The urinary tract infection is caused mostly in your lower urinary tract area like urethra and the bladder, which is very, very common. Now, upper urinary tract infection can be caused due to a descending infection through the bloodstream, which may cause an infection in the upper urinary tract. The most common bacteria that cause UTI are E. coli or Escherichia coli that you have heard of, right? So this is the most common cause for urinary tract infection, but other bacteria like staph can also cause urinary tract infection. So I had to take a minute to write that down. So E. coli is the most common cause for urinary tract infection, and then UTI can also be caused by Staphylococcus saprophyticus. Now, Staphylococcus saprophyticus is seen in sexually active young women upon the onset of sexual activity, right? So if any of you have young daughters, or if you have little daughters that, when they become teenagers and they become sexually active, the moment the doctor says you have Staphylococcus saprophyticus infection, they are grounded, because that's due to the onset of sexual activity, right? So this particular infection is only caused upon the onset of sexual activity, and then it goes away. So you don't see this infection in older women. So the other types of infection that can cause any change in turbidity is pyelonephritis, which is the inflammation or swelling in the kidneys caused by E. coli or other bacterial infection. Sometimes what happens is that the lower urinary infection spreads to the kidney, which can cause a pyelonephritis. And then you have cystitis. Let me see, cystitis. Pen, where's the pen? Yeah. So you have pyelonephritis, cystitis, Cystitis is specifically a type of UTI where E. coli causes inflammation, or any bacteria causes inflammation or swelling of the urinary bladder, right? And then you have other vaginal infections like trichomoniasis or bacterial vaginosis, vaginal candidiasis, meaning yeast infection. A lot of us, at least once in a lifetime, we've had yeast infection, because yeast infection is even caused by a lot of stress in the body, which alters the pH of the urogenital tract, right? So the passage of lymphatic fluid through the urine is called chyluria. You know what chyle is, right? Chyle is a combination of lymphatic fluids with the fats from the digestive tract, and when these fats get exhausted in the urine, it's called chyluria, right? And this is a normal condition wherein the lymphatic system starts, maybe due to a damage, or the lymphatic system damage closer to the urinary tract leads to the exit of chyle in the urine, which is not normal. So chyluria is a condition which can be seen in case of diseases like elephantiasis that we talked about in the class. Now, certain drugs like ceftriaxone can also cause urine to look cloudy, right? So drugs also cause cloudiness in the urine sometimes. So the other reasons that you can see turbidity in the urine are listed over here. Crystals like casts, CAST, And bacterial infection, lipiduria, is basically the presence of lipids, which is caused sometimes by chyluria as well. Presence of mucus in the urine can cause turbidity, semen, and fecal contamination can also cause cloudiness of the urine. So we know how urine smells. It smells like ammonia, and it smells even stronger in older people because their skin takes up some of the responsibilities of the urinary system, right? So it's not that the pee smells really bad, it's just that the skin starts taking up the roles of purification of the blood, right? So the urine has some odor associated with it. Some foods like asparagus, you've heard of people saying that, asparagus makes your pee smell really bad. That's because it has certain chemicals that affect the smell of the urine. Vitamins help will affect the smell of urine, and a lot of times when people take so many antibiotics and so many medications, their urine and even feces smell like antibiotics and medicines, right? So penicillin can cause urine to develop an unusual color. Now again, infections like urinary tract infection can make your urine smell bad. Yeast infection can also make your urogenital region and the urine smell bad. And another condition that you're probably aware of is diabetes mellitus. Diabetes mellitus means, sweet smelling, right? So urine smells really, really sweet due to the presence of glucose in the urine. So back in the day when they didn't have any urinalysis, they used to smell the urine to check for the presence of diabetes, and they also used to taste urine to check for the presence of sugars. Now, the other condition you may or not have heard of is called maple syrup urine disease, or MSUD. Now, MSUD is a genetic disorder that leads to a progressive degeneration of the nervous system and eventually brain damage. It's a defect that produces a particular enzyme which is important for breakdown of amino acids like leucine and isoleucine and valine. Right? So without this particular enzyme that you don't need to know, without the enzyme, it's called BCKD enzyme, the amino acid build up to toxic levels in the body, and the urine ends up smelling like maple syrup when the blood it gets when the levels of certain substances become really, really high in the urine starts smelling like maple syrup, right? This is a really rare condition, and it occurs in only 1 in, say, 180,000 people. And it has been found that MSUD affects people from all backgrounds, but the rate of incidence is higher in a population where it is left obviously untreated. And if it's untreated, these infants will definitely die within the first months of their life. Now, one thing that I'd like to talk about is the presence of ascorbate. Now, ascorbate can be present in several different types of food, and ascorbic acid in higher concentrations in urine can lead to really high false negative results in other urine tests, but particularly with glucose. Where is glucose? There it is. Glucose test and hemoglobin test, which is really blood, right? So the hemoglobin test and glucose test can be affected, and the clinical findings can be overlooked if too much ascorbic acid is present in the urine. And ascorbic acid can be present in dietary supplements like vitamin C. So this is something that is very carefully looked at when performing a urinalysis test. Now, glucose test is something that you're really aware of. When the blood glucose level is really, really high, like in uncontrolled diabetes, it spills over into the urine when the person is hyperglycemic. right? And this usually causes proximal tubule dysfunction of the nephron, and you see glucose in the urine. So negative glucose right over here, yeah, right over here you see negative, I think this is glucose, right? So negative glucose level is normal, and in the presence of positive results, any positive results in the glucose is called glycosuria, or presence of glucose in the urine. And that can be due to kidney damage, conditions like diabetes mellitus, or the presence of any medications, or adrenal gland issues. All of these can contribute to the presence of glucose in the urine. And even pregnancy sometimes can cause gestational diabetes. And that's why this is tested for in pregnant women. Why is it important to check glucose in pregnant women? Because it can cause in the presence of high amounts of glucose, when a pregnant woman is a diabetic, it's called gestational diabetes. And in the presence of gestational diabetes, it can cause the fetus to become overweight, right? And that's why it's very important to monitor gestational diabetes in women. Now, the other condition that we need to look at is ketones. Now, ketones, negative is normal. And what are ketones? Ketones are found or formed when fat is broken down to produce energy. So when this happens, the body produces ketones or ketone bodies. The three major things that are excreted as a result of production of ketone is acetone, acetoacetic acid, and beta hydroxybutyric acid. So these three chemicals that you're seeing over here are byproducts of ketone breakdown. Okay. Now, this is not good at times, because when you're using ketones for producing energy, that means you do not have enough glucose available. So the use of ketones instead of glucose is a sign of starvation and fasting. And even in the presence of low carb diets, when people will go into keto diet, you find really high levels of ketone in their body. So when people do too much strenuous exercises or they exposed to cold, even then they end up using ketones instead of glucose sometimes. Now, when you see high levels of ketone in conjunction with glucose, it could be a medical emergency, because that would be a sign of diabetic ketoacidosis. Now, diabetic ketoacidosis is tested using a urinalysis strip, but the problem with these urinalysis strip that it only tests for one product, which is acetoacetate. It does not test for the other possible byproducts of ketones. So there are other strips available that only tests for ketones, but keep in mind, as the patient improves, you still see them producing acetones and acetoacetate and beta hydroxybutyric acid, right? So this test is not so reliable for checking diabetic ketoacidosis, but as a first step, if you see the presence of ketones in conjunction with glucose, it is a sign for diabetic ketoacidosis. So one thing I forgot to mention in the previous slide about ketones is that sometimes low levels of ketones can be found in the urine of healthy pregnant women, right? So let's move on to the next two important tests, leukocytes and nitrites. Now, leukocytes along with nitrites can be tested for tested while looking at urinary tract infections, right? So leukocyte esterase is an enzyme which is secreted by white blood cells, and obviously you don't want to see white blood cells or red blood cells in the urine. If you do see WBCs in the urine, it is a sign of infection. Now, a positive leukocyte esterase test results from the presence of white blood cells. When they lyse, they release the enzymes, and this happens in times of, say, urinary tract infection or any internal damage to the urinary tract infection, right? Along with nitrates. Nitrites are produced by gram-negative and some gram-positive bacteria. So E. coli, the bacteria that we talked about, produces nitrites, and a positive test results in the change of the strip color to pink, and this indicates the presence of bacteria. And followed by the leukocyte and nitrite test, they usually use a spectrophotometer or a very sophisticated instrument to test for the presence of bacteria in the urine. Now, some other conditions that causes a positive test for leukocyte and nitrites can be nephritis, cystitis, which is the infection of the bladder, or any abdominal inflammation can lead to a positive leukocyte and nitrite test. So the presence of blood in the urine is called hematuria. Hematuria can be caused either due to contamination, that's the most common cause. So menstrual blood can make your urine look red, and sometimes it can cause due to urinary tract infection, hemorrhoids, or kidney stones. Now, kidney stones are formed when you have too much oxalate and calcium and uric acid in the blood, and these uric acid, oxalate, and calcium combine with other salts to form crystals. Now, these crystals can sometimes, when they pass through the urinary tract, the ureters, they can cause damage, and they can cause some amount of bleeding. But obviously the presence of blood in the urine is not good. Now, this usually happens in extreme conditions when there's an internal damage to the nephron, right? Otherwise, the presence of presence of blood in the urine is never a good thing. So this test shows negative test for protein, and then you see the different colors for different concentration of protein. Now, there is some amount of urine excreted in the protein, but not too much. Sometimes when your urine looks really, really turbid, it may just be really concentrated. When you drink a lot of water, the turbidity goes away, right? And this turbidity may be due to protein if it's not a urinary tract infection. Now, normally we excrete up to 150 milligrams per day total protein content in the urine, and about 20 milligrams per day albumin. Now, albumin is the most abundant protein in the blood, and the test strips are usually sensitive only to albumin. They don't detect all the proteins in the blood, okay? But too much protein in the blood is an indication of kidney disease, but you can also see protein during urinary tract infections, hematuria, or glomerular disease dehydration, which can cause your urine to look really, really turbid. And leukemia can cause protein content in the urine, or lead and mercury poisoning can also lead to high protein content. Now, something that you probably have heard of is preeclampsia. So preeclampsia is is the event before eclampsia, right? Pre means before, right? So preeclampsia is the condition before eclampsia. Now, eclampsia is a severe complication in pregnant women. It's really, really rare, but it can cause seizures during pregnancy, and it can cause it can be fatal to the mother and the baby. So a red flag during pregnancy is obviously preeclampsia, and they look for three things when they're looking for preeclampsia. They look for really high protein content, they look for swelling in the hands and legs, and they look for high blood pressure. These three are a combination that the clinicians look for to detect preeclampsia, and the baby may be delivered early if the mother is diagnosed with preeclampsia. So if you end up working in the labor and delivery department, this is what you'd look for in gynecology when you collect urine samples from pregnant women. And again, heart failures has always been linked to high protein content in the urine. So really high heart protein content can be an indication of a cardiovascular disorder. So the pH of the urinalysis is not so significant because urine has a wide range of pH, 4.5 to 8. And in some situations, it's actually beneficial to keep the urine alkaline or acidic. For example, if a person has a tendency to form cystic stones or uric acid, it may be helpful to keep the urine alkaline or less acidic, because if you have too much uric acid, then you end up having gout, right? Or you can have kidney stones if you have too much oxalate. So it may be desirable for such people to have a more alkaline urine. Now, medications can be given to make the urine more alkaline, but that's under extreme circumstances. Now, some other situations, it may be more beneficial to keep the urine more acidic. For example, patients that are prone to excessive urinary tract infection, it may be helpful to have urine more acidic, because alkaline urine promotes the growth of certain bacteria. Now, alkaline urine also promotes the growth of formation of calcium phosphate and renal stones in some clients, right? But this is in the blood itself. It is not affected by the composition of the urine. So if you keep the acidic urine more acidic, it may help prevent sometimes calcium stones and infection as well. And traditionally, people have used a lot of vitamin C or cranberry juice to increase acidity, and it has been observed, there's no scientific proof, but cranberry juice has been found to be helpful in people with urinary tract infection. And milk products and citrus fruits, on the other hand, make urine more alkaline compared to cranberry and vitamin C. So one thing that is really important to look at, especially in older patients in nursing home or people with acute kidney diseases, is specific gravity. Now, specific gravity in a normal person of a normal urine is in between 1.005 to 1.035. Now, when the specific gravity is close to 1.001 or 1.01, it is about close to the osmolarity of serum. Okay, 1.01 is close to the osmolarity of serum. Now, if the specific gravity is really, really low, that is probably due to excessive hydration or due to conditions like diabetes insipidus, wherein a person is really, really thirsty and they drink a lot of water. This means if the specific gravity is really, really low, the urine is really dilute, right? Now, if the specific gravity is close to 1.035, that means it's really high, and this happens when the urine is really concentrated. Then this can have several different causes. It can be due to excessive dehydration, or it can be due to a condition known as SIADH, wherein person secretes inappropriate amount of ADH, and there's not enough water released out of the body, right? So other conditions can be due to cirrhosis, glycosuria, proteinuria. All of these can cause changes in specific gravity. Now, if the specific gravity is really fixed and there's no change in specific gravity at all, this can be a sign of advanced kidney failure. The next condition, the next test that we need to look at is, let's see, bilirubin and urobilinogen. Now, bilirubin and urobilinogen are formed as a byproduct of blood, right? And urobilinogen is formed from bilirubin in the intestine, and then it is reabsorbed and then filtered out of the urine. So the negative for bilirubin is normal, and these tests are not so reliable. So a lot of clinicians don't really look at these tests as a confirmatory test, and when you have high bilirubin amount, it's a possible sign of liver disease in conjunction with urobilinogen. Now, urobilinogen, if you see trace amount, if it's low, then it is a sign of biliary duct obstruction or hepatic diseases. If urobilinogen is really, really high, it is a sign of liver disease or liver damage or destruction of RBCs.